Hello, this is Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat, the UK's number one veterinary podcast. But we're not going to do a podcast today. We've got Zofia Gilmer Macarena Sanchez Martel, recently wed, who I had the pleasure of both meeting at ISFM conference in Dublin in June, July time. So it's been difficult to track you two down, but you're here. And we're going to be talking about the ISFM conference. And of course, when we only talk about cats, it's not a podcast anymore, it's a podcat. So welcome to the podcat.
Thank you very much.
It was a great conference. Dublin is a beautiful city. It's not quite as warm as some of the other ISFM conferences I've been to. I think the ISFM family like to go to sunnier climes, sort of places, Macarena, where you're from originally. So perhaps introduce yourself to the listeners.
Sure. So I'm Macarena. I'm from Malaga. I graduated in Cordoba in 2013. No, sorry, no. I can't even remember. Yeah, 2013. Oh my goodness. And I came over to England a few years back. Sorry. We got a little cat here, the podcast. There we go. And I moved to Sheffield 10 years ago, and here I am. Still here.
Yeah. And 10 years a vet, nearly 11 years a vet. I remember being 10 years a vet and realizing I couldn't say that I was a young vet anymore. Is that fair, or am I being unfair with that?
I'm always young in spirit, but no, unfortunately, I am not young vet anymore. But with experience comes an extra degree, isn't it? So you get more confident, you get to learn more things every day. I'm just still learning every day, that's for sure. But here we are every day.
Brilliant. And then Zofia, tell us a little bit about you for the listeners.
So I graduated from Glasgow University in 2013, went straight into small animal practice, and then I've been working in South Yorkshire, mainly Sheffield, since then. Couple of years in, quickly realised that actually cats were my thing, have started sort of specialising a little bit further, but still very much a GP vet and enjoying everything that brings.
Yeah, I think similarly, when I was in practice, I did a certificate in dermatology. That was my particular passion, although obviously cats, and dogs. But if you really pushed me, I'd probably say I'm more of a cat person than a dog person. And I know you've both done the fellowship or the membership with the Australian College, particularly looking at feline. So perhaps tell us a little bit about that. And in fact, did you meet on that, or did you meet because you were both in that South Yorkshire area?
So, to the owners.
So we both started off with doing the Feline Medicine course through the University of Sydney, which is very sort of structured, 10 modules covering all aspects of feline medicine over 2 years. And then following that, there is the option to sit the membership exam to become a member of the Australian and New Zealand Society of Veterinary Surgeons. So Macca and I were doing it at the same time, and I got a little email one day being like, hey, I'm in Sheffield too, do you want to be a study buddy? So we met up, got on famously well. What was meant to be a quick coffee, we ended up getting kicked out of the coffee shop about 4 hours later because we were chatting about everything, and then met on a regular basis in preparation for our exam. And I think that was probably part of the reason that we managed to pass, because it wasn't an easy exam by any means. So
not an easy journey, but it was so much nicer with her by my side.
Yeah.
So much easier.
I think collaborating with each other. I mean, we used to call it cheating, didn't we? You sat in the same room and you said, "What have you done for this one?" It's ridiculous because we work better together when we work together, don't we?
Yeah,
Always.
definitely. Mm-hmm. So there was lots of time spent trawling through past exam papers and going through how we would answer them, and just getting somebody else's perspective of it.
Yes.
It's really helpful. Absolutely. Or somebody else's way of learning something. Like we sort of had strengths in different areas, so having someone explain an aspect that you were struggling with in a slightly different way can definitely make all the difference. So,
and also having someone that goes through the same thing that you are going, because it's difficult to understand what you're going through when you have someone so close to you that is like going exactly through the same stress, same emotions. So it's a very, very helpful to have a study buddy, honestly. And a friend for life.
When you're up, Zoff might be down, and actually, I want to give up on this, and actually, you encourage each other
Exactly.
to carry on, don't you? And vice versa, obviously.
yeah,
exactly.
Yeah,
There's bad days, there's good days, but having someone next to you, telling you, "Good morning, we can do this." It was every day we woke up saying, like, "We got this, we can do this," even though we thought that we couldn't, but we did.
And brilliant, well done for passing both of you, but also
Thank you.
having those cases that you were working on, in your practices. Again, look, this is the way I've approached this feline diabetic. I'm not having success. Can we have a think about it? Can we talk about it? I remember one of our most lovely testimonials we had was from a vet who said, I was struggling with a feline diabetic, and I decided to go home, look at a couple of hours of vet webinars from people like Mike Heritage, Ian Ramsey. All right, these are the things that I'm not doing quite right. Let's go back on that. And suddenly they have a well-balanced diabetic cat. And that's why you do, CPD and training. It's to actually make you better at the job, rather than, as lovely as I'm sure your certificate from Sydney and from the Australian College is, actually, that doing that qualification has made you both better vets, hasn't it?
Yeah, and give us such a confidence as well.
Yeah.
Picking on things that we couldn't pick up on that before, like, things like, oh, actually, I've never seen this before, or I may have seen it before and never realized that it could be that. So.
Yes. And actually, when you study, it's always interesting because you also realize, oh, that's what that cat had 3 years ago that I had no idea of.
Precisely.
Yeah, it was very much the more I know, the less I know, which is a very humbling experience, actually.
Yes.
The big question is, did you get out to Australia to sit the exam, or was it all done on this boring online way, which, sorry, I probably was partly responsible for?
So we did get a little trip down to London. So that was fun, but not Australia, unfortunately.
It's not Sydney, is it? London?
No, it's not Sydney.
Doesn't have the bridge or the Opera House.
No.
It was a great experience.
Yeah, fantastic. And I think just before we go on to ISFM, because obviously I think we all had a good time at ISFM, but it's actually really interesting. You're both 10, 11 years qualified, and we do have a problem with attrition. I've just been chatting to the CEO of AHA. They've done a great paper on stay please, the great attrition, why we're losing vets. And I had a really poor first 2 years. I struggled, but I wanted to be a vet. I had some people who weren't particularly nice to me, but I wasn't going to let that spoil the dream. So I carried on, and I had a reasonable clinical career. But we lose a lot of people in that sort of first 5 years, don't we? And yet, if we can get people over that hump, actually, with experience comes confidence. And I think there's a danger, people leaving in the first 5 years, they've had a bad experience. I was speaking to a young vet who dropped a year. 3 of our colleagues who are friends, one's had a bit of a breakdown. 2 of them have had a bad experience in their first job and left the profession. It's such a shame to see that. Did you have times, perhaps in your first 5 to 10 years where you thought, I really want to be a vet, but this isn't the job for me? And how has, the training that you did with Sydney and with the Australian and New Zealand College, how has that learning helped to sort of transform you into the, 2 fantastic, I'm going to say the word young compared with me.
We'll take it. So yeah, I mean, I definitely had a rough first couple of years. I think in practice, I think you go from this very well supported sort of insular environment at vet school to out on your own. And I think at the time we qualified, like a lot of these sort of new grad schemes weren't quite in place yet. And there was still very much an attitude of, you know, kind of
Swim
get
or
on with
drown.
it. Yeah, basically.
Crack on.
Yeah, absolutely. So yeah, it was tough. But for me, actually finding an aspect of practice that you really enjoy and developing your knowledge in that area, that gives me real job satisfaction. And then also with what you've learned, educating others in the practice, or, chatting to fellow colleagues, again, that just helps with the sort of job satisfaction. So there are still tough days, and there's still days where you're like, why am I doing this? But actually I think with experience, and also with, CPD, and finding something that you're really passionate about, that definitely increases sort of job satisfaction for me. So
Yeah, so in my case, I was left when I came to England. I found my first job, and after 3 months, I was left on my own, as a new grad. I was like, great. So it was really tough, and obviously, you have to do a lot of self-learning. And in Spain, is not CPDs are not as compulsory as they should be, as they are in the UK. And being able to have to do every year, having to go through CPD, going to congresses, learning about different things, it made me actually float rather than drown. So it was really good. But I specifically remember this case of a cat that I had to refer because he had feline asthma, and I panicked. I didn't know how to treat a cat with feline asthma, and I referred it. So that's what I started to say, right, I need to crack on with feline medicine. I know nothing about feline medicine because in Spain, I mean, things are changing quite a lot, but we kind of was told, well, cats are like small dogs. I was like, no, they're not small dogs at all. So obviously that really kicked me in the teeth and said, right, you need to learn about cats. And the more I was learning about them, the more I loved them. And then I found out about this course, the one that Zofia and I met onto, and I was like, right, I'm doing that. And then the rest is history. Yeah. So it was really rewarding. And now I see a cat, oh, that's fine. We know what to do now. So it takes you through different stages of like, I come from a place of like fear every day of not knowing what I'm doing, like books, looking, oh my God, what can it be differentials? And to say, okay, I've got a patient, let's do a correct examination. Let's see what happened here, what can we do? Obviously, we don't know everything. Even though after we finish these qualifications, like I still don't know everything. But at least you have resources to go back to. And I felt like it made me a better clinician, definitely more confident. And as well, you know your limitations. You know when it's the point to say, okay, I need to refer, because that's what you should be doing. Like, I know how much I know. And when things are getting out of hand, we need to find some more help. But yeah, definitely CPD, learning every day. Every day we learn. That's it. Absolutely.
And because you're so close together and have such a great relationship, presumably, if you do get that difficult case still, I would guess who's on speed dial with each other's phone.
Absolutely.
Yeah, absolutely. Which is really helpful, and we're very fortunate that we've got that. So yeah.
We're talking about this cat you had yesterday. I was like, wow. So we definitely do chat about cases we have, like, what did you do with this?
I mean, I had the same experience to you, Macarena. I kind of realised I had no idea about dermatology, and was using steroids because that was what everybody did. And then realising, I'm not sure this is actually the right way to be doing this. And actually, do I recognise what a pyoderma looks like? How am I going to get better at this? And I remember going to a course in Llandudno and with Richard Harvey, and the sort of, okay, this is, if we apply this logically, it makes a lot more sense. And then spending the couple of years as you did to get the certificate of veterinary dermatology, and at the end of it, really feeling confident that I'd turned from maybe being an empiricist as a young vet into a proper scientific clinician. So much so, I always tell the story. My daughter was in school, and it was the lesson of what do your parents do. So, teacher, nurse, lawyer, whatever the profession or job they were doing, electrician, plumber. And they came to my daughter, and this was while I was studying hard for my certificate. And they said, "What does your dad do?" And she said, "He reads books." That was my job, to read books.
Reading books.
So Yeah,
That's so sweet.
it's good to finish it off and have that feeling of satisfaction. But then, of course, learning is lifelong. We never stop learning, do we?
Never.
Are you currently looking for a new role? Or maybe you're thinking about locuming but don't know where to start? Contact Simply Vets. We are a sister company to the Webinar Vet. We offer a tailored recruitment guidance to help you secure a dream permanent role. And we run locums payroll too, which is free for the locums to use. Visit simplyvets.com to find out how we can help.
So we all were at ISFM, two cat experts, me coming along for the ride because I don't really practice anymore. But I always love the ISFM conference. I think it's so well organised. The quality of the speakers is excellent. And I think the two areas that they touched on this year are such important areas. The cat, unfortunately, the kidney is an issue, isn't it? They have weaker kidneys perhaps than we would like, although they still can live for such a long time. And particularly, we talk a lot about chronic kidney disease because that's the problem we see. But at this conference, it was more around acute kidney disease. So what would be your 2 or 3 tips, take-home messages that you took away from the conference and maybe with your own experience of what we should be doing and how we can, one, diagnose this and make sure that we're not missing it, and then, giving suitable treatment going forward? Do you want to start the ball rolling, Zof?
Yeah, absolutely. So one thing which I think we're sort of all generally aware of with cats is how vague the symptoms can be. They just seem to show the same clinical signs for all spectrums of diseases. There was quite a bit of discussion about sort of ureteral obstruction and how it's probably sort of more common than we maybe initially appreciated. But I think the difficulty that we have with these cases is they might present just with being a bit off colour, bit inappetent, and that's all you've got in front of you. Like, you don't necessarily get this cat which is really PUPD. And I think the Congress just definitely emphasised the fact that when we're presented with an ill cat, it's really important that we're doing a really thorough workup. So, getting on it, getting our blood work done, checking for an azotemia. And there was definitely a lot about the importance of imaging with these cases as well. Like, we really should be sort of imaging our urinary tract. So, a block bladder cat, for example, just doing an x-ray, if it's stable enough prior to unblocking, in a third of cases that would actually reveal potentially what the cause of the obstruction is. And with our sort of ureteral obstruction, a quick ultrasound of the kidneys can tell you a lot. In general, sort of a young, healthy cat, we shouldn't really be seeing any dilation of the renal pelvis. A cat with a ureteral obstruction, if you're getting a dilation of greater than 13 millimeters, I think they said, that's pretty suggestive of ureteral obstruction. So yeah, I think definitely need to, any sort of ill cat, vague signs, crack on and work it up. And also the importance of sort of imaging these sort of urinary cases, because that can tell us vast amount of information.
I don't know what either of you do. There's been this big rise in that whole area of POCUS as well, point of care ultrasound.
Yes.
Do you both have those machines, or do you prefer just to go for a full-on ultrasound if you have a case coming in, to abdominally ultrasound it?
Well, ultrasound is not my strength. We all know our weaknesses. But interestingly, after the Congress, they just said it's so easy. Just put it in certain places. And after the Congress, I started using it. It's like, okay, it gives me the confidence to say, you don't have to be an ultrasonographer. You don't have to do a certificate to be able to see certain things, like what Sof was saying just now. It's like, just put it there. Do you know what a normal kidney looks like? If it looks abnormal, take a picture and then you can look into it. So it just gives you the confidence to say, use it. You got a tool, use it. I've run away from it because I don't know how to use it properly. I used to, but I'm like, okay, the more you use it, the more you get to it, and the more confident you'll become. Again, it's learning every day. And I had a blocked bladder last week again. So I just did everything I had to do, as you know, we learned the course as well. And it's just, and the Congress they were saying, and I did my x-rays and my ultrasound, and I felt okay, you know, I felt more confident to use them. I was looking for certain things that are quite important to look into. And that's the beauty of it, because you just go to a Congress and you think, I can't do that. And then they said, you can. And you're like, all right, I'll give it a go. So I said, I didn't use the ultrasound as much as I used it for the Congress. I'm doing POCUS quite a lot now. Maybe not great, but I can tell these days, like, oh, that's abnormal.
Yeah. What about you, Zof?
So yeah, I would say ultrasound is not my strength, but definitely becoming sort of more confident in it. Definitely trying to use, you know, both ultrasound and also radiographs for the workup of the urinary cases, because doing both increases the chances, the sensitivity of, you know, finding something, especially with detection of sort of bladder stones or sort of uroliths and things. Also, just even in a case which is renal, like you can also end up scanning the chest. So if you've got a cat on fluids, you know, you're wanting to monitor that you're not overhydrating them, quick probe on the chest. Have we got greater than 3 B lines in our field? Or actually we might be, you know, giving this cat too much fluid. Checking sort of the heart size, caudal vena cava. Are they too big? Are they too small? That can help us assess sort of volume status as well. So yeah, I think definitely just using it more.
Yeah, I think it's a really good point, because obviously cats are so small, and yes, they're not little dogs, but it is so easy to over perfuse them and cause problems, isn't it?
Yes.
So we have to be quite precise with our fluid therapy. You know, even with a cat that we think it's got kidney disease, you can overdo it, can't you?
Yeah.
Mm-hmm.
Yeah, absolutely. I think in your head, especially if you've got like an AKI case, you're like, I just need to get as much fluid into this cat, flush the kidneys out, and it doesn't work like that. Like you can give
No.
them too much. You obviously want to get them, you know, rehydrated,
Yes.
make sure you're allowing for any sort of additional losses and things and maintenance, but having them on 5 times maintenance isn't going to improve that azotemia for them.
Yeah. And I suppose where you can potentially miss it is when you take x-rays and you've got the big kidney, little kidney syndrome, where, you know, we have missed those not so obvious signs earlier on, and then I think there was still some work at the conference where sometimes you can help things if you can unblock quickly enough, can't you?
Yeah, definitely. So with the sort of upper urinary tract obstructions, you know, some of them will respond to medical management. So getting them on fluids, I think sometimes maybe giving them a diuretic can help as well. Obviously, you know, monitoring to see if your renal parameters are improving. But I think the vast majority which obstruct sort of the ureters, I think a lot of them do need sort of referral and sort of bypasses placing and things, but it's being aware of these conditions in the first place. So if you get one in practice, you know, you're going to be able to sort of recognize it and then can get everything in place to put the best provision of care in for that cat, really. So I think the more that we're talking about these conditions, because I don't think it was mentioned when I was at university about ureteral obstruction. Like we all knew about urethral obstruction. We were all quaking in our boots on call that you would get a blocked bladder. But nobody mentioned ureteral obstruction. So, and I think it's
and what
definitely
to do either.
Yeah.
Like, what do you do afterwards?
Yeah, I definitely don't want to be put forward for doing some of the bypass surgeries. I think that's we leave that to the surgical experts, I think.
Oh gosh, 100%.
Obviously, you know, kidneys and bladder stones, or stones in uroliths in general, are very sort of intimately linked. You know, certainly part of why you might get kidney disease. But it was interesting at the conference talking about the number of bladder stones where we operate on mistakenly, and this is where, of course, nutrition is so important, isn't it?
Important.
Nutrition obviously for kidneys as well, but, you know, particularly talking about it for bladders. How do you prevent that happening? And my feeling when I saw those figures of, I think it was 50% of stones taken out post surgery are struvite, and obviously could have been dissolved and dissolved quite quickly. Is that something that, is it young graduates who don't kind of get that, or is it older vets and sometimes, who are a bit blasé? They've seen a stone and they're very good at cutting open a gap, going into a bladder, fishing stones out, and actually missing a bit. Where do you think that discrepancy comes? Because, I remember when I was, even when I was a student, I was very interested in nutrition. I did all the Hills exams, kind of saw the importance of kidney diets, how they could extend life, obviously bladder diets in the various sorts. So obviously would look and look at urine under the microscope to see what I thought the stones were and things. What do you think is happening there? Or was that very much an American story as well? Because obviously it was Jodie who was talking about it. What are both your thoughts? We'll start with Macarena first.
Yeah, thank you. I would say that when I was first graduated, I've done it. I've removed stones and was struvite. I didn't know that. So I think the further we're going with feline medicine, the more awareness there is. People now these days know, hold on a minute, what do we have here?
Yeah.
I think knowledge is the key. It's like awareness of, you don't have to cut into a bladder to get a stone if we can fix it with nutrition. And again, I'm guilty myself. I've done it in the past. As a new grad, you're there, you have to fight stone. It's like, oh, I need to remove it. And in a way you think, right, I can fix this cat. But I think new grads, because we had a few new grads in my practice and they are very on it. I think new generations are getting more awareness of this, and I think we're doing a great job of passing on the message and making people aware of this. And so that we have a new grad now, she's wonderful, and she will never go into a bladder because she's aware of the solution. Again, I know 10 years ago, yes, I've done it because that was what you should do back in the day. But I think between podcasts, ISFM, there's such a big awareness these days of going forward. So recently as well, one of my colleagues who was like, oh, I got a bladder stone. I was like, what is it? Have you checked the urine? Do we have crystals? And he's like, oh, I think it's just true. It's like, right, we're going to go for the solution. He's like, okay, how fast it's going to be? It's like faster than you think. So that's the thing. It's like people still don't know how fast we can dissolve struvite crystals and stones with diet. Simply just that. Then you had the client that said, oh, he doesn't like that food. It's like, well, we can help you to get through that, little by little, trying to get through that. Obviously, you might have the odd cat that will not eat that food, but at least you have to try. You have to encourage them to go for that. There's different brands, there's different flavors, there's different textures. So there's gonna be always a way together. We're gonna be able to find something for them. Just help them through rather than go with a knife and get them out.
I feel like I've missed out a bit because Buddy, the cat who adopted me during the pandemic, is
adopted you
in the room. Whereas your cats have obviously been very well trained to walk across the screen. But we know this is the thing, cats are fastidious also with diet. So I think it's a great point. It may not eat the Hills diet, but it might eat the Royal Canin one.
Royal Canin one, exactly.
Vice versa, or the Purina or whatever. Anything to add on that, Zof?
So yeah, I guess a couple of things. I think the difficulty that we have often with these cases is that cats don't always follow the textbook. So I think sometimes it's not very clear cut. It's not very obvious. You can examine a urine sample and you might see struvite crystals. It doesn't necessarily mean the stone you're seeing on your x-ray is definitely struvite. We know that, in the vast majority of sort of upper urinary stones, you can be pretty confident that they're going to be calcium oxalate. So, they're not going to dissolve. That's something that you need to be screening the cat for hypercalcemia, and that's a whole different story. And then generally, our calcium oxalate stones, like if they were in the bladder, tend to be sort of smaller. We might have more of them, but there is definitely an overlap. So that can make it, I think, as a clinician, difficult to sort of interpret. But I think, like Macca says, I think you don't necessarily have to rush to surgery, and if you're suspicious of the struvite and that it's not at detriment to a cat to not cut straight away, then absolutely try with the diet, because if it is struvite, it will dissolve really quickly. So
it was really interesting seeing some of the pictures about how quickly things could dissolve, and then also being able to see how stones looked. You can get an indication from a radiograph what type of stone it is as well, can't you? So all of these things are helpful. And you were both talking about ultrasound before, and obviously it can be misleading, but my favorite tool that I had in practice was my microscope, because you can learn so much in all well, not in all fields, but in a lot of fields with a decent microscope, can't you?
Yeah, definitely.
I think the key message there is, obviously, if it's struvite, we should give it a chance. Although, again, sometimes with diet, my worry was always, a cat that was, for example, kept on SD for too long could then be more prone to getting calcium oxalate, couldn't it? So it's this balancing act all the time of how stones can come and go. And obviously, as you said, the upper urinary tract stones are much more likely to be oxalate stones, aren't they?
I think, with our urinary diets, a key thing is to be maximizing the cat's hydration. So lots of wet food, there's that Purina Hydrocare, for example, sort of water fountains, all of that stuff, because regardless of what type of urinary diet they're on, if our urine is nice and dilute, it's not going to be super saturated. So theoretically, they shouldn't be sort of forming those stones in the first place. So I think a lot of it's sort of client education about that side of things as well.
Cats like to get their water in different ways. I've got a bird bath outside, so Buddy will go out for that. I don't want to talk about the rather disgusting habit of trying to get water out the toilet.
Cats.
They do strange things, don't they? They're awkward.
Oh, 100%. But that's why we love them. So
absolutely. Yeah, but something really interesting, because we had we went to a behavioral talk as well, didn't we? With Sergio. He was great, and he was talking about like I never realized that actually putting water next to food, like my own cat had water next to food for years. Like, it's just like they don't like to have it. Like they don't like to have the water in a corner, but they cannot see anywhere around. So I'm just now saying to people, just like put the water away from the corner so the cat can turn around so he can see what it's doing, rather than having to go to a corner and drink water for them. So there's different things we can try to do, like adding a bit of warm water to the wet food to make it more smelly as well. So there's a lot of good tricks that we can do to encourage to the hydration as well.
And definitely,
and behavior.
As we also would want it, not necessarily putting the food or the water next to the litter tray.
Precisely. That's location is so important as well. So and litter trays as well, because other thing is like cats are lazy, they don't want to go to the toilet, they are scared of the litter tray being put on top of or next to the washing machine, so they don't evacuate, so the urine stays for a bit longer. Again, you have more chance of the urine to be more concentrated. So it's just like, remember, so we were talking about that last night, about the different kind of litter trays, to make sure that 2 litter tray one to another is a big litter tray, make sure they're clean, the substrate they have, either they're covered, they're uncovered. So you need to offer the cat different kinds of litter trays to make sure that they are using the toilet as they like. Because again, they're cats and they're not just gonna sit and settle for anything. So they just want to find the liked one.
Yeah, no, definitely. Listen, it's been absolutely fantastic speaking to you both. Good to relive those memories. Of course, reliving them helps to sort of concrete that knowledge as well, doesn't it? That we've all learned 6 months, 7 months ago. But I really appreciate your time, some really good insights. I always say with a podcast or a webinar, if people who are listening can take 1 or 2 things away from that, bring it into the professional practice, then it's been a half an hour well spent. And I've certainly enjoyed spending this half an hour with you both.
Oh, thank you. It's been great.
It's been lovely. Thank you so much.
Thank you. Thank you both for taking time. Thanks everyone for listening. Hope you found this useful. Hopefully see you on a podcast or a webinar very soon. This has been Anthony Chadwick from the Webinar Vet, and this has been VETchat, the UK's #1 veterinary podcast. Thank you. Bye-bye.